Capacity assessment is a very common station in the MRCPsych CASC exam. In this video, I will show you a simple step-by-step approach based on the Mental Capacity Act, so you know exactly how to structure your assessment during the station. In the UK, capacity assessments are guided by the Mental Capacity Act. In CASC stations, examiners are not only testing your knowledge, but also how clearly and systematically you assess capacity. To determine capacity, we assess 4 abilities. The patient must be able to understand the information, retain that information long enough to make a decision, weigh the information by considering the risks and the benefits, and communicate their decision. In CASC stations, always start by introducing yourself and explaining why you are speaking to the patient. For example, hello, I am Dr. one of the psychiatry doctors. I would like to talk with you about the decision regarding your treatment so we can understand your views. You can set the scene or set the agenda by saying that I'm here to assess your ability to make decisions about your treatment. Capacity assessment stations are usually started by doing a brief mental state examination of the patient. Remember, it is a brief mental state examination and you are not expected to do a full MSc for capacity assessment. You may have to ask about the mood of the patient, just to see if a severe depression is affecting the decision-making process. You may need to ask about psychotic symptoms just to see how the delusions are affecting the understanding of the patient, or whether the mental health in some ways is affecting the person's ability to weigh the pros and the cons of the decision. You might also need to assess cognition of the patient briefly, just to see whether the patient is able to retain or the patient's retaining ability is affecting the decision-making process. You can also assess whether the patient is under the influence of alcohol or any drugs, or maybe under the influence of any other person to take a decision which is unwise. Next, it is important that we assess the understanding of the patient. To assess for the understanding, ask the patient to explain what they know about their condition and the treatment being offered. For example, you can ask, can you tell me what you understand about your illness? And are you aware about the treatment that the team has suggested? Can you tell me more about what has been suggested? Next, assess whether the patient can retain the information. After discussing the treatment, you can ask them to repeat the key points to see if they remember. Weighing the information means the patient can consider the advantages and disadvantages of the decision. You might ask, what do you think are the benefits and the risks of taking this treatment? Finally, the patient must be able to communicate their decision. And this can be verbal, can be written, or through other means, but it must be clear. It's important to remember certain key principles of the Mental Capacity Act. We must assume capacity unless proven otherwise. We must support the patients to make their own decisions. and understand that making an unwise decision does not automatically mean a person lacks capacity. Now, how to close the station? To end the station, summarize your assessment and explain the next steps. For example, thank you for discussing this with me. I will document our discussion and the team will review the next steps regarding your care. It is important that you communicate what is the outcome of your assessment, which means you let the person know what do you think about his capacity. So say very loud and clearly that I think you have the capacity to refuse treatment, or I think you do not have the capacity to refuse treatment. Now, depending upon your conclusion, you can suggest the next steps. So if you think that the patient has the capacity to refuse the treatment offered, say it loud and clear. Say that based on our assessment, I think you have the capacity to refuse the treatment. However, it appears that the decision that you are making or taking is probably unwise or against the medical advice. Maybe you can take some time, think about it, and we can have a chat again. So you can offer the person some more time to reconsider the decision. On the other hand, if you think that the person does not have the capacity, again, say it very clearly. Say that based on the assessment, I don't think you have the capacity to refuse treatment. So in that case, I will let the treating team know the findings of my assessment and they will be helping you in your best interest. So it depends upon your assessment findings that you need to plan the next steps. So here is the 7-step framework for capacity assessment in CASC. Step 1 is to introduce and set the context, wherein you will be explaining the purpose of the discussion. Step 2 is to clarify the decision, like what decision are we assessing. Step 3 is to briefly do a mental state examination, focusing upon the mood, psychosis, cognition, or intoxication. Step 4 is to assess the understanding, wherein you need to ask the patient to explain the treatment, explain the condition in his or her own words. Step 5 is to assess retention, wherein you are going to ask them to repeat key points about the treatment which is being discussed. Step 6 is to assess whether they can weigh up the information, whether they can weigh the pros and the cons, whether they can consider the alternatives to the treatment as well. And step 7 is to assess whether they can communicate their final decision clearly. Would you like to have more preparation like this for CASC exam? Subscribe to the channel as I will be uploading more videos for CASC preparation and CASC tips. I have structured courses created in the form of modules and courses. You can find the link in the description. And if you think it can be helpful for your preparation, you can register for the course and the modules for a lifetime access. Thank you. See you in the next video.